Welcome to this explainer. Today, we're diving into the Lifeline Express, bridging India's rural healthcare divide. You know, when we picture a modern hospital, we usually imagine a massive, stationary concrete building in the middle of a bustling city. But what happens when the patients who desperately need that care can't even afford a bus ticket to get there, let alone the medical bills? Well, we're going to look at a radical rethinking of medical logistics that literally puts healthcare on the fast track.
Let's kick things off with a pretty staggering number, 1 to 11,082. That is the official doctor-to-patient ratio in India right now. I mean, just imagine an entire small town where every single resident has to share just one doctor. That is the daily reality here, and it's actually 10 times the limit recommended by the World Health Organization. The burden on the everyday medical system is stretched way beyond its absolute limits. But as shocking as that number is, it only tells half the story.
The crisis gets a whole lot deeper when we look at this disparity between the 70% of India's population living in rural areas versus the mere 3% of doctors actually practicing there. It's really about where these doctors are located. The vast majority of medical professionals are concentrated in wealthy urban centers, building up this booming medical tourism industry, while millions out in the countryside are left without access to even basic first aid. And looking at the rural healthcare infrastructure deficits, the picture is pretty bleak. We've got 871 million rural residents relying on chronically underfunded clinics. I mean, with barely 1% of India's GDP spent on health, these communities are incredibly vulnerable. Imagine trying to deliver a baby or run life-saving equipment, only to realize your clinic is part of the 4% with no electricity, or the 7% without a regular water supply. You can instantly see the tragic consequences, like an alarming neonatal mortality rate when you're fighting diseases without power or even a place to wash your hands.
So, how on earth do you solve a problem this massive? If patients can't afford to travel to the city, and building new, fully powered hospitals in remote villages is way too slow and expensive, well, you put the hospital on wheels. Enter the Lifeline Express, affectionately known as the Magic Train. It's the world's first hospital train, brightly painted and waiting on the tracks, ready to roll directly into the heart of the countryside to bypass those infrastructure failures entirely.
Now, a public-private partnership between the Impact India Foundation, the Health Ministry, and Indian Railways is what makes this all possible. To pull off something this logistically complex, you need serious teamwork, right? Back in 1991, the Mumbai-based Impact India Foundation kicked this off. The railways provide the train and guarantee essential water and electricity at the rural stations, while the NGO coordinates the medical facilities and sponsors. It's a brilliant collaborative model designed to bring high-quality, totally free medical care to neglected pockets where commercial healthcare just won't invest.
And step inside, and this completely subverts your expectations. You're looking at a pristine, high-tech operating theater situated right inside a train coach. It's honestly a bit mind-bending. You've got state-of-the-art surgical lighting and operating tables housed within the curved metal walls of a tube that usually ferries commuters. But this is exactly what allows top-tier surgeons to perform delicate procedures safely right out in the middle of nowhere.
Over the last 3 decades, it's evolved way beyond its humble 3-coach beginnings. Looking at the advanced amenities of today's 7-coach train, it's totally self-sufficient. We're talking 3 state-of-the-art operating theaters, air-conditioned patient wards, a pathology lab, an X-ray unit, plus mammography and dental units. They've even got onboard Wi-Fi, their own power generators, and lodging for the permanent medical staff who literally live right there on the tracks.
But a train like this doesn't just show up unannounced. Let's look at the anatomy of a project. It takes a solid 6-month prep phase. First, a medical team does an assessment of the rural area. Then, they team up with local centers for the preliminary screening of inhabitants. They run massive local promotion and awareness campaigns so folks know help is definitely coming. That way, by the time the train arrives for its 1-month stationary stay, the patients who need it most are already screened, scheduled, and waiting.
Once that month starts, the pace is just relentless. And the free surgical and medical services offered are truly life-changing. They're doing cataract operations for sight restoration, plastic surgery for cleft lips and burn contractures, and complex orthopedic surgical interventions. They also handle epilepsy diagnosis, neurological treatment, and more recently, even advanced cancer care. And for the patients at the absolute bottom of the economic ladder, every single one of these procedures is completely free. When you add up all those 1-month stops over 3 decades, the scale is almost hard to comprehend. 1.2 million. That is the number of rural Indians this magical hospital train has successfully treated to date. That's over 1 million lives profoundly transformed. They are restoring sight, hearing, and mobility to people who otherwise would have lived their entire lives suffering from entirely preventable or treatable conditions.
And it turns out the train is just as magnetic for medical professionals. It's widely considered a surgeon's dream, having drawn in over 100,000 medical volunteers from across the globe. Doctors happily give up their time because this setup provides a rare, highly functional environment to serve people in desperate need. Plus, it gives younger surgeons from smaller towns a chance to learn advanced microsurgery skills right alongside top experts.
To really grasp the geographic reach here, just look at this map of the expansive Indian railway network. We're talking about more than 67,000 kilometers of tracks. The train uses these rails as the physical arteries of a massive, nationwide healthcare delivery system. Leveraging this pre-existing infrastructure lets the hospital train thread its way into the absolute deepest rural territories of the country.
But of course, this raises an important, deeply practical question. What happens to places without railway lines? How on earth do we reach the millions of people who live miles and miles away from the nearest train tracks?
This right here is the spatial inequality challenge. Reaching isolated communities beyond the tracks is definitely the train's biggest physical limitation. It's an absolutely brilliant model, but if you live 50 miles from a station, the magic train simply can't help you. It really pushes us to figure out how we can combine this rail model with smaller mobile vans or modern telemedicine to finally reach those entirely off-the-grid communities. Yet comparing the original 1991 Lifeline Express surgical concept with the massive 2020 COVID-19 pandemic adaptation shows just how vital this whole idea is. When the pandemic hit, it completely overwhelmed the traditional stationary health system. Hospitals ran out of beds almost instantly. Suddenly, turning train carriages into hospital wards wasn't just a niche philanthropic project, it was a matter of urgent national survival.
The Indian government actually looked at the decades of success from the Lifeline Express and said, we can do this. They rapidly stripped down standard railway passenger coaches and mobilized, converting 5,000 of them into mobile COVID-19 isolation wards. It was this rapid, massive-scale deployment of the exact same logic. If the hospitals are full, we literally have to build new ones on the tracks.
And by doing that, they unlocked 80,000 emergency beds almost overnight. 80,000! They deployed these converted trains to rural regions and smaller cities where local medical facilities were completely failing. It's a pretty remarkable testament to how an innovative solution designed for rural poverty could actually be scaled up to defend a whole nation against a pandemic.
And a brilliant idea like this doesn't stay secret for long. Look at these global hospital train adaptations. Other massive nations totally followed suit. Back in 1997, China launched the rainbow-painted I-Train. South Africa introduced the Felafepa health trains, and in Russia, you've got the St. Lucas train traversing the freezing expanses of Siberia to deliver critical care to isolated towns.
Ultimately, it all points back to this vision from the World Health Organization: the highest attainable standard of health as a fundamental right of every human being. The Lifeline Express proves that geography and poverty shouldn't dictate your chances of survival. It takes concrete, logistical steps to make that vision an actual reality, rolling that fundamental right directly into the stations of the folks who need it most.
Which leaves us with this final thought. As global crises escalate, are adaptable mobile healthcare networks the ultimate solution to achieving true medical equity? I mean, as our populations keep expanding and new health crises pop up, the traditional stationary hospital might just not be enough. Will the hospital trains of tomorrow be the definitive key to closing that rural-urban medical divide? Thank you so much for exploring this journey with me. Keep asking those big questions, and I'll see you in the next Explainer.